Hello everyone, this is Jessica Kobzak, and I want to talk with you today about managing cancer-related fatigue with exercise. This is an evidence-based practice change recommendation for the primary care setting. As a current RN and student in the MSN Family Nurse Practitioner program at the University of St. Augustine, I chose this topic due to a need that I saw in the outpatient setting where I work, dealing with oncology patients on a regular basis. As their infusion nurse, I commonly hear the complaint that these patients are fatigued, and so this became of interest to me as I started doing some investigation. My objectives for the presentation are that by the end, you will be able to name one reliable tool to measure cancer-related fatigue. Second, that you'll be able to differentiate between the appropriate patient population to recommend the intervention to. And thirdly, that you will be able to describe the frequency, duration, and type of exercise that is most likely to improve cancer-related fatigue. Okay, so the outline for the presentation. First, I will talk about the problem, why cancer-related fatigue is so important. Then I will go over the PICO question that I used to guide my search. Then I'll go over the search strategy specifically that I used to find the evidence. Following that, I will go over the synthesis of literature and what exactly the evidence said. I'll go over the clinical recommendation and what we should be doing for our patients experiencing cancer-related fatigue. Then I will go over the change process, how I envision implementing the change. Then I'll go over the evaluation of the evidence-based practice change. And then lastly, I'll go over dissemination and how I plan to tell others about what I found. So what is the problem? Why is cancer-related fatigue an issue? Well, we know that there's an estimated 15.5 million cancer survivors living in our communities in the United States, and there's an estimated 80 to 100% of oncology patients that experience fatigue at some point. Cancer-related fatigue is associated with a decrease in quality of life that impacts the patient's work, their relationships, their daily routines, and can even impact a patient's ability to care for themselves or their self-care tasks. Looking at the economic aspects, one study found that 75% of patients with cancer indicated a change in employment status due to their fatigue. So these are patients that are working less hours or changing from full-time to part-time, etc., because they're tired. That same study found that caregivers are taking off an average of 4.5 days per month to help care for their loved ones with this symptom. This last statistic I found very interesting. Fatigue levels may predict how long a patient with cancer is recurrence-free and overall survival. So that's a pretty startling statistic to think that fatigue levels may predict overall survival. The PICO question that I used to guide my search was the following. In adult patients with cancer, how does exercise added to standard of care compared to standard of care without the addition of exercise affect cancer-related fatigue during treatment and after treatment has ended? And I'll go into each aspect of the PICO. Breaking down the PICO, I looked at a population of adults with any type of cancer that were either receiving current treatment or post therapy. I did exclude hospice patients. For the intervention, I looked at exercise, including aerobic, anaerobic, resistance training. I did exclude mind and body exercises such as yoga, as well as dance interventions. For the comparison, I looked at standard of care or standard of care plus another intervention. As long as the exercise group could be isolated as causing the outcome change, then I included the study. For outcome, I looked at specifically cancer-related fatigue measured using a handful of dependable and reliable tools. And again, for the timing, I looked at patients both during their active treatment as well as post-treatment. The search strategy. For simplification purposes, I went ahead and attached my Prisma chart here. This summarizes the overall search. I used two main databases. The first one was a PubMed database, and the second was the Cochrane database for systematic reviews. My key terms in the PubMed database were fatigue and cancer or chemotherapy or radiation or surgery, and exercise or physical activity. For the Cochrane database, I use the key terms fatigue and cancer and exercise. And so with both of these searches, I came up with a total of 336 non-duplicate citations. And then after applying my inclusion and exclusion criteria, I eliminated the majority of those 327 and was left with a remaining 10 articles. And then after further digging into the articles, one was excluded due to not using a reliable tool in the study. So my total was 9 articles. Synthesis of the literature. I found several themes in the evidence that I want to highlight here. The first one is that aerobic exercise was seen as the most profitable type of exercise for the patients. And this was observed in a step-like pattern, so that the more exercise the patient did, the more benefit that they saw, with a higher frequency providing the higher benefit. The second theme is that the benefit was seen in different types of cancer. So that's including colorectal, cancer, breast cancer, hematological malignancies, prostate cancer, patients with solid tumors. The one group that did not see a benefit from the exercise were patients that had undergone a hematopoietic stem cell transplantation. This group did not see a statistically significant benefit from the intervention. Thirdly, the benefit was regardless of the type of cancer treatment, whether patients were undergoing or had undergone radiation, chemotherapy, or surgical interventions. All of these groups saw a positive improvement in their cancer-related fatigue. Continuing with the synthesis of the literature, additional themes that I found were that the benefit was seen in patients both during their active cancer treatment as well as post-treatment. Additionally, the intervention was effective in patients performing the exercise at home individually as well as in group settings. So there's some flexibility there depending on the patient's preference, how they want to perform the exercise, as well as what they might have available to them. The clinical recommendation. So I'm recommending that all patients with cancer be assessed for cancer-related fatigue using the brief fatigue inventory form. And this is a very short form. It takes less than 5 minutes for the patients to fill out. And I provided a link here for you to access that form. The goal is for the patients to participate in 300 minutes per week of moderate to vigorous aerobic exercise, increasing as tolerated for life. And that benchmark is really where patients started to see the most benefit from the exercise. So that would be the goal, although some patients may not be able, most patients probably won't be able to do that at the start. That would be our goal. They should always consult with the primary care provider if fatigue worsens over time or if the exercise is not helpful for them. In addition, this is not for patients with planned or former hematopoietic stem cell transplantation, or for palliative care patients, or for patients with a diagnosis or other comorbidity that would make the exercise unsafe. Okay, so moving on to the change process, I envision implementing this in the primary care setting using Rogers' diffusion of innovation model. And this model talks about how people are ready to embrace change at different times. Some people are more willing at the outset to embrace the change process, whereas others are more hesitant and prefer to wait and kind of see how it goes. So I would start by educating the staff via email, group meetings, bulletin boards, various means to get my message out. And then I would identify practitioners who are ready and willing to embrace the change. So once we start implementing the change, I envision this as a patient walking in and being taken back to the room. And at the point where the medical assistant or nurse is usually taking their vitals and asking them a few questions, they would ask the cancer patients, "Are you experiencing fatigue?" And this is not an in-depth assessment at this point. This is a simple yes or no question. If the patient says yes, then they would provide them with a brief fatigue inventory form, a BFI form, to be filled out at that point. If the patient says no, then we move on. And then once the provider comes into the room, they would go over that form and provide the recommendation for the intervention at that point. And also at that point, they would explain to the patient to fill out an additional BFI form. They would give them one to take home. So the second form they would fill out at the 3-month mark after performing the intervention at the recommended dose and frequency at the 3-month mark to fill that out again. And this is for evaluation purposes. So evaluation of the change. There's two parts of this that I want to talk about, the outcome measure and the process measure. The outcome measure is looking specifically at cancer-related fatigue and whether or not the patient had improvement. This is using data collected from the BFI form before the intervention and after the intervention. The data collected would be considered interval data, and it would be analyzed using the paired t-test accordingly. The process measure, I would have a goal of 90% compliance among providers to be recommending the intervention when appropriate. This would be measured via chart audits. Were the appropriate patients given the forms? Were they provided the intervention recommendation or not? Now I want to talk about dissemination and how I plan to tell others about my findings. So first, I would consider publishing in a scholarly journal because this has a reach institutionally, regionally, and nationally, as well as having a longer term dissemination effect. So my first choice would be the Clinical Journal of Oncology Nursing, with my second choice as the Supportive Care in Cancer, although there are a plethora of oncology nursing journals that discuss the topics that I presented here. So the second way that I would disseminate would be via presentation at either the American Society of Clinical Oncology or the Oncology Nursing Society. And both of these have frequent calls for abstracts and also cover the topics that I presented here. So in conclusion, I've provided you with the problem, why cancer-related fatigue is so important, the PICO question that guided my search, the search strategy specifically that I used to come up with the evidence, the synthesis of literature, what the evidence said. Then I talked about a clinical recommendation, what exactly should we be doing for our patients with cancer-related fatigue. Then I talked to you about how I envision implementing this change, evaluating the change, and how I will get the information out to others. This concludes my presentation. I hope that you found this information both helpful and informative, and that you feel prepared to both assess and help your patients dealing with cancer-related fatigue. Thank you so much.